Welcome. Today we're diving into a common heart condition called degenerative valve disease. Also known as valvular heart disease or acquired valvular heart disease, it affects millions worldwide. Understanding this condition is crucial for early detection and effective management. Let's explore what it is, what causes it, and how it's treated. So, what causes this disease? Degenerative valve disease primarily stems from the natural wear and tear on the heart valves over time. Think of it like the hinges on a door that get creaky and worn out with age. Factors like calcium buildup, scarring from past infections like rheumatic fever, though less common now, and even congenital heart defects can accelerate this degeneration. In essence, the valve leaflets become thickened, stiff, and less flexible, hindering their ability to open and close properly. Now, let's delve into the pathophysiology. The heart has 4 valves: the mitral, aortic, tricuspid, and pulmonary valves. In degenerative valve disease, one or more of these valves becomes damaged. This damage leads to 2 primary problems: stenosis and regurgitation. Stenosis is the narrowing of the valve opening, making it harder for blood to flow through. Regurgitation is the leaking of blood backward through the valve when it should be closed. Both of these issues put extra strain on the heart. Over time, this strain can lead to heart enlargement, heart failure, and other serious complications. Degenerative valve disease is largely age-related, making it more common in older adults. Prevalence increases significantly after the age of 65. While it can affect anyone, certain risk factors like high blood pressure, high cholesterol, diabetes, and a history of rheumatic fever can increase the likelihood of developing the condition. It's important to be aware of these risk factors, especially as we age. The signs and symptoms of degenerative valve disease can vary depending on the severity and which valve is affected. Some people may experience no symptoms for years, while others may have noticeable problems. Common symptoms include shortness of breath, especially during exertion, fatigue, chest pain or pressure, lightheadedness or dizziness, swelling in the ankles and feet, and heart palpitations or an irregular heartbeat. If you experience any of these symptoms, it's essential to see a doctor for evaluation. Diagnosing degenerative valve disease typically involves a combination of physical examination and diagnostic testing. A doctor will listen to your heart with a stethoscope to detect any abnormal heart murmurs, which are characteristic sounds caused by turbulent blood flow through a damaged valve. An echocardiogram, which is an ultrasound of the heart, is a key diagnostic tool. It provides detailed images of the heart valves and allows doctors to assess their structure and function. Other tests, such as an electrocardiogram, ECG, chest X-ray, and cardiac MRI, may also be used to further evaluate the condition. While we don't traditionally classify degenerative valve disease into strict types, in the same way we might classify, say, cancer stages, it's useful to distinguish based on the affected valve. We have aortic stenosis, where the aortic valve is narrowed. Aortic regurgitation means the aortic valve leaks. Mitral stenosis and regurgitation are the corresponding conditions for the mitral valve. The severity of each condition, whether mild, moderate, or severe, also plays a crucial role in determining the treatment approach. Treatment for degenerative valve disease depends on the severity of the condition and the presence of symptoms. For mild cases with no or minimal symptoms, regular monitoring with echocardiograms may be all that's needed. Medications can help manage symptoms like high blood pressure or heart failure. However, for more severe cases, valve repair or replacement surgery may be necessary. Valve repair aims to restore the valve's function, while valve replacement involves replacing the damaged valve with a mechanical or biological valve. The choice between repair and replacement, and between mechanical and biological valves, depends on individual factors and is best discussed with your cardiologist. While we can't entirely prevent age-related degeneration, adopting a heart-healthy lifestyle can significantly reduce the risk and slow the progression of degenerative valve disease. This includes maintaining a healthy weight, eating a balanced diet low in saturated and trans fats, exercising regularly, managing blood pressure and cholesterol levels, and avoiding smoking. If you have a history of rheumatic fever or other heart conditions, be sure to follow your doctor's recommendations for management and prevention. The prognosis for degenerative valve disease varies widely depending on the severity of the condition, the presence of other health problems, and the effectiveness of treatment. With early diagnosis and appropriate management, many people can live long and fulfilling lives. Recent research is focused on developing less invasive valve repair and replacement techniques, such as transcatheter aortic valve replacement, or TAVR, which can be performed through a small incision in the groin. These advancements offer hope for improved outcomes and a better quality of life for those living with degenerative valve disease. Always consult your doctor for personalized medical advice.